In the previous training, we discussed how you can manage an institution on this system. In this particular training, we'll be taking you through how to manage patients and by the healthcare professional. So to start with, we assume that you have created your professional account and you have been enrolled in an institution where you work, because this is very important. If this has to be done, you must be enrolled before you can start working. Otherwise, all your work will not be flowing to the institution where you work. So having created your professional account on the system, which you can do from this registration point once you visit healthserves.org with X after serves. You create your professional account by selecting registration for professional/supporting staff, and you fill this form. Make sure you add your image here, then you click on register user and you have your professional user account, and then give that to the institution where you work for them to enroll you. In the alternative, they can create an account for you within their institutional dashboard. That has been covered in the previous training. So now we assume you have your account and you have been enrolled in an institution as well. So time to log into your account. So you key in your user ID here under this user ID. Automatically, because this professional has been enrolled previously, the institutional ID, which is the gateway, has been triggered already. So I click on login. So now I've logged in. I can start adding new patient into the system. Just like the way you create a professional account, you can add your patient from here, and you click on add patient button once you fill this form. In the alternative, so once that is done, you can start attending to patients. There are 5 options, but I'm going to touch on three basically. One is fingerprint option. You simply ask the patient to place their thumb on this fingerprint scanner I have with me. So you click on it and they place their thumb twice on it and click verify. It will tell you who the person is and retrieve their folder instantly. So you can see it has done that. So it's retrieving the folder of the patient now. So the process is completed. To create new folder, you start from here, create new record, you click on that button, you start creating new record. So, but let's go back and try 2 more options. Another option is to use the phone number of the patient. Phone number is required at the point of registering the patient account. So you simply key in the number that the patient declared as their phone number. And for the first time, you will use the default password of the account to log into it. Subsequently, within the same institution, you will not need password any longer. You simply click on this verify after entering the phone number, and you can retrieve the patient folder. All right, so this is also done. So let's try one more time, another option. So this time around, we're going to use the patient ID. Okay, so the patient ID is this option. I think the patient via patient ID. So you simply enter the patient ID, which I'm putting now PAT 0142 0AAA. So you can see the same thing that happened to phone number happens here as well. So the moment I put the user ID, which has been attended to before within an institution, it will override the need for password for a returning patient. So once this is done, I can start my documentation. And it depends on what you want to do. But obviously, you may need to start from clinical clerking. So once you click on clinical clerking, the system will load all the tools for you from patient complaint, quite a number of tools, so many of them, but it depends on what you're doing. Then vital sign, for instance, you can report all of that, blood pressure, pulse rate, respiration, and then diagnosis, physical examination. For instance, physical examination, you can see the head, ear, eye, nose, throat. Under that, you can see it has a lot of sections depending on the complaint and the area of the body that need to be examined. tongue, tonsil, say on that section. Then you go to the next section, which is the neck. If you want to examine the neck, maybe someone is complaining of neck pain, you can examine and state what you observe on the neck. Then next will be respiration. You can examine the respiratory system and declare your observation here. Remember, we are on physical examination, and so we have to report exactly what we observe. So cardiac under listen to the lung, palpate the carotid and temporal pulse bilaterally, and then listen to heartbeat. Abdomen, inspect the abdomen, listen to four quadrants of the abdomen for bowel sounds, palpate four quadrants of abdomen for pain and tenderness, ask about problem with bowel or bladder, then pulse, extremity skin, then check skin turgor, check for lesion, abrasion, rashes, check for tenderness, lump, lesion, and so on. Neurological system. So this tool is really very comprehensive, and with this, you can be rest assured you will better manage your patient. So we beckon on you to explore HealthServes solution, which is an electronic health record system, and see how you can improve your patient management and the quality of care you provide to them. Thank you.